patients often wonder why we want them to come back once they're stable on at least a yearly basis. And the main reason is if somebody's beginning to run into troubles with their weight, we've got something that we can offer them quickly, safely, effectively, which gets them back on track. It's always terrible for patients if they regain 20 or 30 kilograms after weight loss operation. They always feel very disappointed. If they keep in contact with us and allow us to keep in contact with them, then we can often jump on these problems when they're small rather than allowing them to become big problems for them.
One of the illustrations I use, which really helps people, is thinking about our dental health. So people just don't go for 5 years and never see the dentist. If they want to stay with healthy teeth, they have regular check-ins. And actually talking to patients about that, the fact that we want to keep you healthy, well, and at weight long term. I mean, no one wants to do bariatric surgery and put the weight back on again. Yeah. That's been helpful in just conceptualising the fact that this is a long-term thing and that checking in is really helpful. And I also chat about a flow chart of what to do when they're starting to put up on weight. And so if we're on a yearly check-in but they're struggling, I'm really keen to get them back earlier. And so we often talk about if they've put on more than 3 kilos to actually get on the phone and come and see us again after they've tried some strategies. And they actually quite like that because often they can get on top of it on their own. But if they're not and it's sort of they've tried some things and it's still going up, they're better to connect back in.
Yeah, that makes sense. I mean, you don't go to a dentist just to have fillings. You go to a dentist regularly to stop you from
getting fillings. And I think that patients really find that that just helps them to get the right framework for what we're on about when we're doing long-term bariatric care. And I think that's an important thing we've been talking about is that we've got our dietitians, we've got you and I, we've got our nurses, we've got our whole team, but actually patients need to be at the centre of their care. Working with the GP, working with their cardiologist or the endocrinologist, the other people, but we're really teaching them how to manage it and and so I also talk about giving them a whole lot of skills that they've got that they can pull on if the weight starts going up, but also that there's no shame in coming back and I won't feel like that's a failure for them. And I think that's really helpful. Yeah.